It's a pleasure to interview Viwat today. After COVID-19, so many Chinese patients they want to know the acknowledge about IVF. They have so many questions. So let's start. The first question again: does third generation of IVF have any side effects or disadvantages?
Thank you for having me today. For this question, I have to say that third generation IVF will use the next generation sequencing technologies for genetic testing of the embryos, which will give us the detailed information about the chromosome number of the embryo to know whether it is euploid or aneuploid, and we'll be able to tell whether there is any mosaicism of the embryos or not. So it will give us more information about our embryos genetically. So to say in brief, there will be no side effect or disadvantage, but in the contrary, there will be more advantage by using the third generation IVF.
I see. So the third IVF technical should be more advanced.
Yes, of course, because the basic in the embryonic biopsy, we will do the embryo biopsy on day 5 or day 6 of the embryo's life at blastocyst stage. So by technically of the embryo biopsy will be the same, either you use the second or third generation, but the technique of genetic testing will be different, will be more advanced. So on the patient side, there will be no disadvantage.
I see.
There will be more advantage.
I see. The second question: how to prevent arrested fetal development?
Okay, for this question, when you transfer the embryos, which is not tested genetically,
yeah,
you will have a chance to transfer an abnormal embryo.
I see.
Which looks good when you look under microscope or morphologically good. This abnormal embryos is likely to have development arrested and end up with miscarriage. That is why we use third generation IVF to solve this problem. When you transfer a euploid embryo back into a normal uterus and endometrium, your chance of pregnancy will be higher, will be as high as 55 to 60%.
They're really
when
high.
you transfer only one embryos, okay?
Okay.
While your chance of miscarriage will be as low as 5%. When you compare to the transfer of embryos which you do not test, which will give you only 35 to 40% chance of pregnancy, and the chance of miscarriage will be as high as 15 to 20%.
I see. So the women who always miscarry should be used third generation is better.
Because patients who experience with repeated miscarriages is indicated for third generation IVF.
Yeah. The second question: will frozen sperm affect fertilization rate or blastocyst?
Thank you for this question. The question is very good. Sperm freezing with new technique called vitrification will not affect fertilization rate or blast duration rate if the initial quality of the sperm are good enough.
Yeah.
Okay.
Okay.
But if the quality of the sperm is so poor, we suggest that the patient should use fresh sperm rather than frozen sperm.
I see, exactly. So the higher age man, he can do the sperm analysis firstly, then we will give his suggestion.
It is a must for anyone who will come for the IVF program.
Yeah.
Male partner has to do semen analysis in details, which nowadays we perform semen analysis together with the DNA fragmentation index testing.
Or DFI.
Yes.
Okay. First question, will stimulation process damage female's ovary function?
This is also a very good question. The ovarian stimulation program will not cause any damage to the ovarian functions if it is performed properly. Okay, the damage to the ovaries may be caused by the ovarian harvesting procedures or ovum pickup procedures rather than ovarian stimulation process itself. Because when you do the egg collection, you have to introduce a tiny needle through a patient's vagina and aspirate the eggs out. So if the procedure is not performed properly or by unskillful doctors, then it might cause damage to the ovaries and to the ovarian function later on.
That's the thing I never know before. So it will require the doctor has the full experience to do that.
Exactly, because when you have a skillful doctors or doctors who is very specialized in the egg collection, not only the time for egg collection will be shorter, but the damage to the ovaries will be less. Okay? Sometimes patient does not feel any pain at all after egg collection.
I see. So that's related to the Ajah's experience.
Yes.